That was terrifying. Today I visited a physical therapy class.
I'm currently in cardiopulm, learning about the system of the cardiovascular system and the pulmonary system and how they come together, and then how to treat that as a physical therapist.
It's such a great experience to be in the classroom, to see our students learning, the excitement that they have. There was really, I think, a very supportive feeling in the room.
Today I was learning a lot about respiratory tract and kind of how to deal with that in the acute care, and just making sure that the patient's able to breathe and if they be able to communicate if needed, and the different ways that physical therapy can help with that. I really found it important just being able to help with suctioning a tracheal tube and being able to help support a patient to be able to communicate and help out in that therapy process. So it's not just about making sure they're getting the oxygen, but make sure that they are taken care of.
I learned how to suction when there's a trach tube, and then of course the importance of adjusting a room and navigating a room when there's different monitors and different types of tubing.
This is hard. I went in there to do trach suction. I think the hardest part was having to put the gloves on and maintain the sterile environment, handling the equipment in the right way so as not to contaminate anything.
I hope to go into neurological physical therapy, help me just kind of be more confident in my skills to learn the basics of suctioning and understanding the tracheal tube. That way I can walk in there not just being brand new.
I just did my first rotation in acute care, and it's navigating the room because every time it's different. Some patients might have one tube, some patients might have several, and I think it's very important so we're not pulling on those tubes and making sure the patient is safe.
The students did great. It was really amazing to watch them work. A million times better than I was doing.
Dean Theriot was actually with me at my table, and we were looking at the basics of the tracheal tube, so it was really cool seeing him learn these basic things and understanding why that we couldn't inflate too much, or what the purpose of inflating the different parts of the tracheal tube and making sure that everything is properly set.
Dean Theriot surprised me with what he was able to accomplish. He was nervous at first when he was going to suction in the trach, but he did really well with some guidance and cueing.
It was great to be in the room and connect with the students, to see how they learn in addition to what they're learning, and to really think about the level of preparation that they're getting to go into the field. That gives me confidence that our healthcare system is in good hands when these students graduate. I hope the dean thing works out because I am not a physical therapist.